Good afternoon, everyone. My name is Dr. Luanu Bello Tambol from My Health, My Pride. Welcome to another program of Let's Talk. And today we are going to talk about breast cancer awareness. Together with me, I'm together with my teacher, also a consultant general surgeon with Usman Danford University Teaching Hospital, Sokoto, Dr. Umar Mukhtar. You are welcome, sir.
Thank you, doctor.
Thank you, sir. So, sir, October is a breast cancer awareness month. That is the purpose we invite you to My Health, My Pride, so that you can enlighten people about breast cancer and also so that they can be aware of the disease and also dangers of the disease and how to go about it. So, today we have several points to talk about. One of the points we need to know is, what is breast cancer, sir?
Dr. Tambwal, it's a pleasure to be on your program. And again, good afternoon, viewers and listeners. Breast cancer, as you have asked, is one of the cancers that has bedeviled mankind. It's one of the commonest, in fact, it is the commonest cancer among women worldwide, and is the leading cause of cancer mortality among women worldwide. And it is here with us. It is a disease of the reproductive organ, one of the reproductive organ of women. And I'm happy to inform our viewers that with the right knowledge and right enlightenment like this, it's a disease that is not a death sentence. It has a cure, and when you come early, you can be cured of the disease, inshallah.
Thank you very much, sir. Sir, if we look at it, breast cancer, if we look at the breast in general, it has, if the disease is affecting the breast, there are some that can be cancer, there are some that may not be cancer. How our viewers can differentiate between breast cancer and non-breast cancer diseases, sir?
Yes, in all honesty, as a layman, it's very difficult to differentiate between a lesion in the breast that is cancerous and the one that is not cancerous. The safest thing to do is, if any woman experiences any abnormality at all in the breast, to consult quickly a specialist so that the diagnosis can be made very early. But having said that, some of the key indicators that can tell a woman that whether she has cancer or not is erroneously lumps and other abnormality that are painful are usually, in most cases, not cancers, while those that are painless, that does not give any pain initially, just a lump or just an abnormality in a woman that is above 20, those are the ones that are likely going to be cancer. But having said that, as I said initially, it's usually very difficult. So it's better and safer, any woman who has an abnormality in the breast, to consult a specialist so that early diagnosis can be made.
Thank you very much, sir. So, sir, we want to know, even among the women, who is at risk, who is more at risk of breast cancer?
Yes, there are several risk factors that have epidemiologically been associated with breast cancer. The more a woman ages, that is, the higher the age,
yes,
the more likelihood that she will have breast cancer. The less children a woman has, the more likelihood she's going to have breast cancer. But I want the listeners to understand here that these are not hard facts. These are just facts that are based on research, so that women that have less children are more likely to have cancer. But I'm not saying that a woman who have less children must have breast cancer, but it's shown that women with less children have more likelihood of having cancer. Women who breastfeed less.
Yes.
Maybe has never breastfed with the breast, or has breastfed maybe only once or or a few times with the breast, are more likely to have breast cancer. Women who are on the fat side, that's obesity,
Yes.
are more likely to have breast cancer. The women who have children late, above the age of 35, they are also more at risk of breast cancer. Women in this in our culture does not smoke and consume alcohol, but those that smoke, and consume alcohol are more at risk. Women who have relatives who have breast cancer, the family history, maybe your mother, your aunt. So all these risk factors, what we are just trying to bring out is that if you know that you fall into, you have some of these risk factor, you should take extra precautions which we might discuss later, to prevent and also to make diagnosis very early. So if you have some of these risk factors, it just says that you should go extra mile of being cautious for early diagnosis.
Thank you very much, sir. Thank you very much, sir. Sir, all our discussion, we have been discussing about women. Can a man also have a breast cancer, sir?
Yes. Men could also have breast cancer, but it's rare. If you have 100 patients who have breast cancer, 99 of them will be women. So it's only one that is going to be a man. It's just that because the breast tissue in a man is very small, the chances of being advanced and poor prognosis in men is higher. So the breast cancer in men kills faster than that of a woman, but it's rare. It's rare, but it's possible.
Thank you very much, sir. So, sir, how can we suspect or identify breast cancer?
The most important thing, as a very important question, the most important thing in breast cancer is early diagnosis, to diagnose the breast cancer early. And that is why we are encouraging, and that is one of the aim of this your enlightenment. It's commendable to identify, because the difference between identifying it early and identifying it late is huge. If you identify it early, the treatment you are going to get is less toxic, and also the outcome, that is survival, the chances of cure is higher. So for early diagnosis, all women above 50 are supposed to have a test we call mammography. So any woman who is above 50, whether you notice anything in your breast or not, should walk into some of the centers, and it's luckily for us, it's available in Sokoto. So if you have above 50, or you have a mother above 50, or you have an aunt above 50, the best thing to prevent or early diagnosis for her is to encourage her to walk into the hospital and have a day investigation, which is painless. Just walk into a machine and it takes the pictures of the breast. It's called screening mammography. That is one of the early signs. Then the next one is for a woman to know, we call it self-breast examination. For a woman to be familiar with her breast. Immediately, if a woman is menstruating, immediately, few days after menstruation, then lesions can be easily detected. She palpates her breast all around, looking at a mirror. If she feels anything, she reports to a doctor. That is another way of detecting it very early. The other way of detecting, if you feel any lump or any abnormality, you quickly go to the hospital. When you go to the hospital, there will be some investigations, ultrasound if you are still young, or if you are old, above 35, we'll send you for a mammography. These two tests will be able to detect early if there is a lesion. And then if there's a lesion that we think is abnormal, we'll take a small specimen from it and send to the lab. It is there, after we send to the lab, that the lab will tell us whether it's cancer or it's not cancer.
Thank you very much, sir. Thank you. Okay, so the next question is like a repetition of what we have already discussed. We, I would like, we would like to know, we would like our viewers to know what are the early signs of this breast cancer.
As we have said earlier, the early signs of a breast cancer is a painless lump in the breast, swelling, a painless swelling in the breast. If you have a painless swelling in the breast, you need to see a doctor. It is then with the investigations that the doctor will be able to tell you whether it's cancer or not. So the common thing that is noticed is early lump, and in most cases, in 95% of cases, this lump is not painful initially. So and that is a false assurance to most patients. Most patients will come to you that they notice a lump that was biadamuna that was not disturbing them, so they left it. So usually it's a false assurance. Usually non-cancerous lesions in most instances are the ones that are painful. Usually the swellings a woman get after or during breastfeeding and other things, all those ones are infections and they're not cancerous. So for cancer, initially, usually, it's a swelling that is painless. So that is the earliest sign. But again, we want to diagnose it even before the woman notice anything. That is why we are saying all women that are above 50 should have screening, and the screening is available in Sokoto. You just walk to the hospital and ask the doctors that you want if you are above 50, that you want your breast to be screened, even without abnormality. And if it's diagnosed at that stage, the treatment is very easy and it's less toxic and less disfiguring than when it has been there for a long time.
Thank you very much, sir. Sir, all these things we have said, we also talk about breast examination, which also a woman can do at home, at her own comfort, in her own bedroom, or in her own toilet, depending on her choice. So, sir, we would like our viewers to know how they should conduct breast examinations.
Yes, as I said earlier, I will repeat for emphasis because it's very important. As I said earlier, diagnosing breast cancer early and diagnosing it late, it's a huge difference in the management of any patient, both the toxicity of the management and also the outcome, and also the money you spend, the resources. So any woman above 20 should know her breast. And how do you know your breast? Is to make sure that at least once every month you palpate your breast. How do you palpate your breast? After menstruation. Usually why we encourage women to do that after menstruation is because immediately after menstruation you find out that the breast is more supple and it's not engorged. So any lesion, any abnormality is easily detected during that period. So a woman should look at the mirror, look at the breast to see if there's an abnormality. If there's none, she will lie down comfortably on a couch, and if she's examining the right breast, she use her left hand to examine the right breast.
If she wants to examine like the
right, she use the left hand and examine it systematically. You go like a cycle, like a clock, all around, and also palpate around the nipple for any abnormality. Then you do the same to the other side.
Okay. If she is examining the left hand,
the left, you use the right hand. While
so that means if she use like this, for example,
it's difficult.
There is high tendency
she may miss some. It's difficult.
Yes.
So she used the opposite hand for the opposite breast, and she lies down comfortably on a couch, and then move around the breast gently and cautiously. Move around clockwise, palpate every aspect, and then the nipple areolar complex. Then she do the same thing. She does that every month, at least once. At least once every month.
Thank you very much.
And if she detects any abnormality, she quickly reports to nearest doctor to her.
Thank you very much, sir. So we have been talking about breast cancer, We would like to know the management or treatment in summary so that our viewers can have a understanding of the management.
Yes, one of the most fearful aspect of the management, which have led so many patients to hide their breast cancer, is the fear of the treatment, and one of the treatment of losing the breast. I want to assure our viewers that if you come very early, there are various options, and some of those options involve not even losing the breast at all. So expectedly, if you come to the hospital, depending on when you come, if you come very early,
Yes,
and the breast disease is quite early,
yes,
and is still located just within a small mass within the breast, and it has been confirmed to be cancer, there are various options. One of the options is just to remove a core of the lump with some normal breast tissue around it. Then thereafter you undergo some drugs. Those drugs are called chemotherapeutic agent. And then lastly there is radiotherapy. And radiotherapy involves going into a machine which has a high energy machine. It dissipates some energy into the breast to kill the small cancer that might not have been removed during the surgery. So other forms of treatment could involve giving other drugs that will take by mouth. The cancer drugs usually are given through the vein, but there are others that are adjunct and other treatment that will be given depending on what the doctor finds on after looking at the breast cancer. So the treatment is multimodal. There are various modalities from surgery, and it's not all surgery that you lose your breast, to giving drugs through the vein and also orally, and then radiotherapy, that is high energy X-rays to the breast.
Thank you very much. Lose a breast than to lose a life.
Yes. But again, our viewers must understand that it's not all instances that the surgery involves removing the breast. So that is more importantly why we should come early. That is more important, because in developed societies where the patients are enlightened and they come early, and that is why this program is also very apt and important for our viewers. Because in the developed world, if you show them the type of cancers we see in Africa, they will be surprised. And the main difference, barring there are other factors that lead to us having big cancers and others. The main difference is enlightenment, coming early. When you come very early, especially those that are even detected before you can even palpate it, you won't lose your breast. The surgery involves just removing the tumor and also the other modalities. But if you come very late, where the cancer has taken almost the whole breast, it's still good, as you said, to still come to the hospital, because invariably, the cancer will kill the patient. Yes. If you don't come to the hospital, the cancer will kill. Because before the advent of treatment, all this treatment that we have now, research that were done on those patients that didn't have treatment shows that 9.5 of all patients, 9.5 of every 10 patients, that is 9 plus and another half of patients, yes. Of all patients that have breast cancer, of every 10 patients that have breast cancer, die from the disease. So if you have breast cancer and you don't have treatment at all, the disease is likely going to kill you. But if you come, it's a curable disease, especially when you come very early. If you come very early, the chances of cure is over 95% for stage 1. That is the one that you even come without even detecting it, or you detect it is still a very small tumor in the breast. The chances of cure is 95, and when we say 95%, that is 95 people in every 100%, and is very good. So there are very effective treatment modalities now, and when you come, the toxicity of the treatment is even less.
Very less. Thank you very much, sir. God bless you.
Thank you very much.